Why there is need for classification? After publication of first repertory by Dr. Honi Hussain, many physicians in the world of homeopathy started indexing symptoms of materia medica in various ways. There are about 200 various type of repertories which can be helpful for different purposes as we discussed earlier. Then some started indexing particular symptoms, some started preparing index of particular disease, and some considered general state or all the conditions of the body during preparation of repertory. So in this way, for easy purpose, many homeopaths they started to work on the repertories. They started to work or write down according to their convenience the different in the different way the rubrics from the repertory. So some homeopaths they started indexing some particular symptoms, then some homeopath they preparing the index of particular disease, which is again then classified into clinical repertories. Then some consider general state or all the conditions of the body during preparation of repertory. So these repertories are called as general repertories. For selection of proper repertory for a case, classification of repertories is needed. So there are so many repertories, and to reach towards the similimum, the need to select the proper repertory it is necessary. Then what is the purpose of classification? Grouping helps to highlight the group characteristics and individual peculiarities of the repertories. For the selection of proper repertory for a case. So the purpose of classification is grouping of the repertories, and this will help to highlight the group characteristics as if the repertories they are based on some fixed philosophical background, or the repertories clinical repertories means from the name itself we suggest it suggests that in clinical repertories it is based on some clinical rubrics. Then the repertories uh, under the first group, that is having some fixed philosophical background, under that the repertories included which are definitely having some fixed philosophy, or the Puritan group of repertories, they are not used for proper repertorization. Card repertories, when we should use these repertories, computer repertories, how they are helpful. So in this way, by grouping the repertories, it will help to highlight the group characteristic and individual peculiarities of the repertories, and for the selection of proper repertory for a case. Repertories have been classified into various groups by different authors, but most comprehensible classification would be as follows. So I told you we just have seen one type of classification, but according to different homeopaths, the classification of repertories is also different. So the most comprehensible classification is this, which we studied just now. The repertory, this is classified into first general repertory, then clinical, then card repertory, mechanically aided repertory, and drug oriented repertory. So under general repertory, the repertories having, it was again classified into two subgroups, that is repertories based on concept of general to particular, and the second subgroup, that is repertories based on concept of particular to general. The example of first subgroup based on general to particular is gained repertory, Lipez repertory, synthetic repertory. Then based on concept of particular to general is BPCR, BTPP, synoptic key, Boger synoptic key. So these are the example of this subgroup. Then clinical repertories. Clinical repertories are again classified into two main groups, that is covering the whole uh, and the covering the region or part. So the covering the whole example is Boric's general, Boric and Clark's clinical repertory. So the Boric's clinical repertory, Boric's general clinical repertory and Clark's uh, Repertorium Generale, which is in 6 volumes. So these are the example of these uh, general clinical repertory or the repertories, clinical repertories which cover the whole person. Then the covering the region. It is also called as regional repertory. It is again classified into three subgroups, that is based on the part, based on the system and based on disease. So if the repertory is based on part, then repertory of eyes. If it is based on system, then repertory of digestive system, example is, and some clinical repertories which are based on disease condition. So these are the repertory of diarrhea. So in this way, the clinical repertory, there is main two type of classification, covering the whole, covering the region. Then under covering the region, based on the part, based on system and based on disease. Then the third classification of repertory is card repertory. So these are the slips of cards. The example of card repertory is Jugal Kishore's card repertory, Sharma's card repertory, etc. Then mechanical aided repertories, these are computer autovisual repertory of, for example, the Patel's autovisual repertory. Then drug oriented, that is repertory of vowel notions. So this is one type of classification. First, the repertory based on philosophical concept. These repertories have their own philosophy behind their construction. Their repertorial totality is based on particular philosophy and therefore used for systemic repertorization. Symptoms change their form to fit into the arrangement of repertories. They belong to logical utilitarian group. Then based on concept of generals to particular, the example is Repertory of Homeopathic Materia Medica by Dr. J.P. Kent, Lippe's Repertory by Dr. Constantine Lippe, Kent's Repertorium Generale by Tinsley, Homeopathic Repertory by Robin Murphy, and Synthesis by Dr. Frederick Stroyens. So these are the examples of repertories based on general to particular. Then the repertories based on concept of particular to general, on philosophical concept of totality based on doctrine of analogy and concomitant. The example is Therapeutic Pocket Book of Dr. Honi Hussain. Then based on complete symptom, concomitant and pathological general. So the examples are Honi Hussain's characteristic and repertory by Dr. C.M. Boger. So these are the examples of repertory which are based on philosophy particular to general. Then the second classification of the repertory, that is repertory with no distinct philosophy. These repertories are known as concordance repertories or concordances. It comprises mainly of the symptoms in the language of doers belong to the Puritan group. For example, Naire's repertory, Gentry's concordance repertory. Then clinical repertories covering the whole and covering the region. So the covering the whole, uh, there are the examples of covering the whole are clinical repertory appended to Boric's Materia Medica, and the second example is clinical repertory by J.H. Clark. Then covering symptoms of the parts or system or condition. So these are first related to part or their regional repertories, also called as regional repertories. For example, repertory of eye by Dr. Berich, repertory of tongue by Dr. Douglas, Minton's uterus, Morgan's urinary organs. Then the clinical repertories related to system. Examples are Homeopathic Therapeutics of Respiratory System by Dr. Van Denver, then Repertory of Digestive System of Dr. Michael by Dr. Michael, Arkel MC Michael. Then the clinical repertory based on some clinical condition. For example, repertory of intermittent fever by W.A. Allen or Allen's intermittent fever, then Bell's diarrhea, then repertory of neuralgia by Dr. Lindsay, then rheumatic remedies by Dr. H.A. Roberts. Then card repertories. Slips of cards that are arranged systematically facilitate the work of finding out remedies. For example, Jugal Kishore's card repertory, Dr. P. Shankaran's card repertory, Dr. S. M. Sharma's card repertory. So these are example of card repertory. Then mechanically aided repertory. So the R.P. Patel's autovisual repertory, Dr. R.P. Patel's autovisual miasmatic repertory. Then the computer repertory, the examples are CARA, Radar, ISIS, Compact, Mac repertory. These are some softwares. These are the example of some softwares in computer repertories. Then drug oriented repertory. Similar kind of group of remedies are represented in these repertories, and the example is a repertory of vowel nosors, which is constructed by Fieldman. Then Ahmed's short repertory to Indian drug, B.N. Mitra's repertory of tissue remedies. So these are the example of the repertories which are based on or which are drug oriented repertories. So in this way, this is one type of classification of repertories. According to different homeopaths, as I told you previously, that according to different homeopath, as there is different philosophical concept, in the same way there is different type of classification also. So the second type of classification is it was classified into three groups, that is general repertories, special repertories and mechanically aided repertories. So So in that, in general repertories, repertory of antisoric medicine, concordance repertory, thematic repertory, and alphabetical repertory. Then in special repertories, some repertories they are organ-wise constructed. Some repertories are clinical repertories. In clinical repertories, the repertories covering the whole and the repertories disease-wise. Then mechanically aided repertories, card repertory and softwares. So in this way, this is the second type of classification of repertories which we will discuss in the next lecture. So is there any difficulty in the first classification of repertories?